Hello everyone, good morning. Now I shall discuss with you the role of Boswellia serrata in the treatment of osteoarthritis, which is known as Janu Sandhivat row. Now this plant or tree is quite abundant in India, and its bark of the stem exudes or excretes the substance that is called as Shallaki. In Hindi, Shallaki is called as Salai Google. Please note that I am not an Ayurvedic expert, therefore do consult an Ayurvedic for treatment. Ayurvedic treatment of osteoarthritis or Janu Sandhi includes several internal and external methods and applications. Internal herbs, chewed decoctions and enemata. External application of the oil and moxibuction. Herbs play an important role, and many herbs have been used and well studied. In fact, curcumin, boswellia, devil's claw, chingatissatta, and rose hip. Rose hip has already been discussed in the earlier. Allopathic treatment is varied, includes medical, physiotherapy, neuroinvestigational, that is re-injection of the cultured chondrocytes into the joint, and surgical is the final one, that is correction of the malalignment, removal of foreign body, and joint replacement by various methods. Current treatment have limitations, we can understand, and this treatment in allopathy includes topical NSAIDs as gel and cream, oral tablets for pain relief, which carry definite systemic risk of renal damage, cardiovascular susceptibility, and other adverse effects. Duloxetine have been tried for severe pain, and topical glucocorticoid injections have been used in single joint arthritis, and intra-articular hyalurons, particularly hyaluronidase, is also found to be effective. Diacetyl is also effective as analgesic alone or along with other agents. But these analgesics, they all carry their individual risk of adverse effects when used continuously. Therefore, many nutraceuticals and food supplements have been used, chondroitin sulfate and glucosamine, and initial it was found to be very fascinating, but in large clinical trials they have found to be no better than placebo. Physiotherapy plays a definite role provided it is sustained and regular exercise. Therefore, Boswellia extract as a part 2 of the discussion, I will focus the role of Boswellia extract in the treatment of osteoarthritis. Boswellia serrata. In fact, the genus Boswellia plant or tree is found in various states of India, and the excretion, the Shallaki, grows Maharashtra, Madhya Pradesh, Rajasthan, and part of the South India. There are 4 species of Boswellia plant: Boswellia sacra, Boswellia frerion, Boswellia serrata, and Boswellia papyrifera. Serrata subspecies is well studied. The bark of these trees produce gum resin that is commonly known as frankincense. The gum resin is called by different names such as frankincense, boswellia, boswellin, salai and also Indian frankincense or Shallaki. It is also called as Gond Kondru. It is very important to understand it is Gond Kondru, not the Gond. It has turpentine-like odor and astringent taste, while Gond is a bland or slight sweetish odor. Extraction of active ingredient from gum resin is called as Boswellia extract, and that contains important active ingredient, that active molecules, that they are called as boswellic acids, which are 4 or 5 types. Please remember, Gond and Shallaki are not same. Gond is an edible gum from Acacia arabica or babool, and it is used as emulsifying and demulcent agent in pharmaceuticals and stabilizer in products such as yogurt, chewing gum, and candies. Gond katira is from astragalus plant. It's called as gum tragacanth, and it is used in toothpaste and lotions. So all are gums, but Shallaki is a different gum. Extraction is done, that is, gum resin is extracted when the bark is cut or damaged, and this resin, frankincense, is a milky substance that solidifies upon exposure to air. The extract is dried and standardized to have a minimum of 40% to 65% of boswellic acids. This is powdered and formulated as tablet. Active ingredients of Shallaki have, actually it has many ingredients: sugars, volatile essential oils, and terpenoids, beta oxycetoestrol and glucosides. The resins comprise monoterpenes, diterpenes, triterpenes, tetracyclic triterpenes, triterpenoids, and several pentacyclic triterpenic acids. Now the last one is important because KBA, ABA, BKBA, and the most important is 3-oxoacetyl 11 keto beta boswellic acid, called acronymed as AKBA. This is the most potent and active component of the boswellic. Boswellic acids in toto, they form the active ingredient, and they have exhibited marked anti-inflammatory activity in osteoarthritis. And AKBA in particular and KBA also have greater activity than other boswellic acids. Therefore, these two boswellic acids have been chosen in the monogram of Indian frankincense in European Pharmacopoeia version 6 as markers to ensure the quality of the air-dried gum resin exudate of the Boswellia serrata. KBA and AKBA, as I told you, they are the powerful inhibitors of key enzyme that produces inflammatory cytokines, and that is called as 5-lipoxygenase enzyme or 5-LOX. Recently, it is shown that low plasma concentration of boswellic acids may also inhibit microsomal prostaglandin E synthase 1 and serine proteases cathepsin G. They are also involved in inflammation. Now, the exact role of boswellic acids, particularly AKBA, can be visualized in this pictorial. Not only it inhibits the 5-LOX pathway, therefore reduces formation of leukotriene A, leukotriene B4, leukotriene C4 and D4, but it may also have cyclooxygenase activity. And by inhibiting these two pathways in general, Boswellia and boswellic acids have very important anti-inflammatory activity in osteoarthritis. Cyclooxygenase pathway is key pathway for inhibition of pain relievers and aspirin, but it is minor for boswellic acids. Now, focusing on 5-lipoxygenase enzyme, large number of studies have been done, and Suya has reviewed the evidence of the mechanism of inhibition of 5-LOX. Boswellic acids specifically inhibit 5-LOX enzyme without affecting 12-LOX activity, and in fact, there is no known such drugs in medical pharmacology that is used for the treatment of osteoarthritis. The only drug that is available as 5-LOX inhibitor in pharmacology is xylitol, FDA approved for treatment for the prevention of bronchial asthma, but it is not used for the treatment of osteoarthritis. As I told you earlier, AKBA is the most potent 5-LOX inhibitor as compared to other acids. The methonolic extract of the B serrata downregulates also The pro-inflammatory cytokines, tumor necrosis factor alpha, interleukin-1 beta, and interleukin-6, and it also inhibits the messenger RNA expression, thereby reduces formation, and it also reduces production of nitric oxide. Aflapin, which is a registered molecule, patented molecule, modulates the cell proliferation of human primary chondrocytes treated with pro-inflammatory cytokine interleukin-1 experimentally, meaning thereby that it may have cartilage protective action. In general, anti-arthritic, anti-inflammatory, antioxidant and immunomodulating actions of Boswellia extract and purified extracts are the key components for their use in osteoarthritis. In addition, MMP3 that causes cartilage destruction is also inhibited. Therefore, multiple actions are responsible for their beneficial action. And currently, Boswellia extracts are used in a large number of disorders as described in Ayurveda: osteoarthritis, rheumatoid arthritis, ulcerative colitis, wound healing, asthma, prevention of wrinkling, regularizing menstrual flow, and reducing lipids in the body, improving insulin sensitivity, reducing weight and metabolic syndrome. It is being studied to improve cognition in Alzheimer's disease, and it is considered to be improving general and sexual health in individuals. Anti-tumor effect of boswellic acid is being explored extensively at present. There are various preparation doses. The powder exudate, decoction, Shallaki oil, Shallaki juice, and Boswellia extract purified 100 mg, that is 50 mg twice daily, is currently recommended in osteoarthritis. Other formulations can also be used depending on the availability and ability to prepare. The absorption of the Shallaki is poor as such, and therefore it is advised that it should be taken just after meals or with high fat meals. Standard extracts are formulated and patented. One of them is boswellia, which may contain as much as 65% boswellic acids. Alpha-pen is available in India, and it contains 20% AKBA, which is enriched with non-volatile oils also, and is very well studied. Phylloxin is also another patented product, and it contains 30% of the AKBA. It is also available at many places in a dose of 100 mg. Large number of clinical trials have been done. I will summarize the evidence from the secondary meta-analysis of large placebo-controlled trials. For example, Yu et al. Found the extract very effective when given for 4 weeks in patients with osteoarthritis. Majid et al. Conducted a placebo-controlled trial using 2 doses of 150 mg extract, boswellia actually patented 300 mg, and given for 3 months. There was a marked pain relief, early pain relief as early as 5 days, and that continued for the period of observation, that is 90 days. It also reduced inflammatory markers. In other trials, for example, Karla Podi et al., who used alpha-pin, Dubey et al., who also conducted the secondary analysis of 9 trials, they all show the beneficial effect of the boswellia extract in osteoarthritis in reducing pain, stiffness, and increasing function. Sengupta, as early as 2008, found phylloxin to be effective in reducing inflammation and pain. It was given at 2 doses of 100 mg and 250 mg for 90 days, and both were effective without much. Combination trials have also been conducted. Some of the examples are given by Chakravarti, Sinha, and Kumar, who used all the 3 extracts together: boswellia, the devil's claw, and the rosehip extract. And there was a remarkable significant improvement with all of them, although doses varied from trial to. The important thing is safety and tolerability. Boswellia serrata gum resin is included in the list of substances generally recognized as safe by the US FDA, and experimentally acute and subacute toxicity testing have found to be no genotoxicity or major adverse effects on the bodily systems. Dermal irritation was not found, and eye irritation was found minimal. In double-blind trials, no hematological alterations, the blood changes did not occur when it was given for 2 months in OA. However, Shallaki may cause nausea, vomiting that can be reduced by taking it just after meals. It may cause diarrhea or allergic fever and dizziness in some. It may have a mild anticoagulant action, which could increase the risk of bleeding in sensitive individuals or those who are already taking anticoagulant drugs. It should be avoided in pregnancy, to young children, and those patients who are allergic to it. Patients with active peptic ulcers should not be used. There are many patients who have diabetes, hypertension, ischemic heart disease, obesity, and osteoarthritis, and at present it is not known how Shallaki interacts with the currently used drugs for these disorders. It would be prudent to stagger the Shallaki dose, giving a gap of at least half to 1 hour when such drugs are taken, till more is known about their adverse interactions. Please also look for the known interactions on patient information sheets provided along with these drugs for treatment of hypertension, diabetes, and if there is a mention of Shallaki interacting drug, then should be avoided. Therefore, always consult and communicate with doctors what you are taking for your ailments. So, summary and recommendations are Boswellia extract and bioenhanced extracts, alpha-pen, boswelline, and phylloxin, all have shown clinical improvements in osteoarthritis of knees and hips when given for 3 to 6 months alone or along with the standard of the treatment. Combination 3 extracts have also been used as they are available. In the recommended doses of 100 mg per day, the purified extract is well tolerated and may cause mild GIT effects. The extract has anti-inflammatory, antioxidant, immunomodulatory, and some of the effects on the cartilage protection, and that may contribute to efficacy in osteoarthritis. Long-term studies are required to prove efficacy in prevention of cartilage damage and halting the progress of osteoarthritis. Presentation, and next presentation will be on devil's claw in osteoarthritis. Meanwhile, you can access the drug information from my YouTube site. And thank you.